This week's question concerns the role of autologous stem cell transplant for young patients with myeloma. The question comes from a young patient who had novel induction therapy and then had a good response following a single autologous stem cell transplant using high-dose melphalan. After this treatment, the doctor indicated that the myeloma was under control, but not completely eradicated or wiped out by the treatment. The question is, do you need to push harder to achieve a lower level of response? And this is something that is a question within the new research initiative from the IMF, the Black Swan Research Initiative. Do we need to have therapy that can push the disease to MRD 0, or minimal residual disease 0, no residual disease left? And the answer to this question depends on the type of the myeloma and the treatment options that we have available. In the first case, there is a possibility that the myeloma can revert to an MGUS state, where it will revert not to 0, but there will be a small amount of myeloma left, which is a benign level, a monoclonal gammopathy of undetermined significance level. And in this case, it's okay to accept this small level of residual myeloma. So there's not MRD 0, there could be a partial response, a very good partial response with residual disease. In this case, if it's a benign level of disease, this is fine. The exact opposite to this is a patient with high-risk myeloma. If there have been high-risk chromosomes present in the baseline bone marrow, if the bone marrow has shown translocation involving the chromosomes 4 and 14 on the FISH testing, or absence of the top of the chromosome number 17, what's called 17p minus, or if there's a lack of chromosomes or loss of chromosomes, which is called hypodiploidy. Those are things which are called poor risk myeloma. In this case, it seems to be particularly important to enhance the treatment with consolidation, where you would give a more intensive therapy, or to start maintenance therapy, both of which could push the myeloma to a lower level and hopefully achieve MRD 0. And so in this case, with a high-risk chromosome pattern, this is the ideal approach. Within the Black Swan Research Initiative, we are attempting to identify these different patterns of disease at a molecular level and with specialized testing so that we can tailor the treatment to fit the patient. In most cases, we would be pushing to try to achieve MRD 0 if possible. In some cases, it could be acceptable to accept a low level of residual disease. This is a very, very important question, and one in which we're going to see a lot of progress in the coming months as the Black Swan Research Initiative moves forward.